in Hampshire. Well, with me here in the studio is Professor Bill Keevil from Southampton University, an expert in environmental health care. Thank you very much for coming in, Bill. We've got a lot of people asking a lot of questions. We're going to try and get through as many as we can. Let's start off with the question that a lot of people are asking, and that is the phrase underlying health conditions. Now, Karen Tibble asks whether a stroke 3 months ago puts you in the vulnerable group, while Denise says her husband has a chronic lung condition. Should they isolate from each other?
Well, an underlying condition would be, for example, heart disease, chronic lung disease, asthma, diabetes, and there's even concern about pregnant women. So in this particular case of that couple, they're both at risk. So the advice would be that they're okay to cohabit without having to isolate from each other. But if one of them goes outside shopping, for example, go to the chemist, then when they come back, make sure they wash their hands properly. And then if one of them does start becoming unwell, that's when they should have separate rooms. And
we should also say, I mean, the NHS has got a helpline, and of course there's a lot more information on there as to whether you come into those vulnerable groups. Julia Palmer asks whether you're immune once you've had the virus and no need to isolate further.
It's a very important question, but the virus has only been around now for about 3 months. So at the moment, we don't know. But people have been looking back on previous coronavirus infections, SARS for example, and there it looks like immunity is there for at least a year.
Now, John Howlett's asking what a lot of people are saying, points out that the last winter 17,000 people died in the UK from flu. Why is the whole world in such a panic, he asks? Is COVID-19 more dangerous than previous strains of flu?
Well, this infection is easily transmissible. And what we're seeing is that if it just goes unchecked, this would potentially affect over 40 million people in the UK. If you assume that 1% of those will die, we're talking of hundreds of thousands of people who would die.
Here's an interesting one from Bob Sargent. Could the virus enter our homes through the letterbox, for example, on our post and junk mail?
Well, we showed a similar virus survives 4 or 5 days on stainless steel, glass, ceramics and plastics. A study has just come out of America. They've confirmed that work, but they've also looked at cardboard, and it survives on there as well. So there is a potential risk. Obviously, if you handle parcels and letters, wash your hands.
Yeah, washing your hands is still absolutely the key thing for anything, isn't it? Jack Aldridge is asking, how bad does it have to be for the entire UK to be in lockdown?
Well, we might be very close to that. The UK strategy, if you recall, was first of all containment and then delay. The government have been practicing mitigation, and this has drawn a lot of controversy from scientific groups. So with the numbers of cases increasing and the potential to overload the NHS, they've now decided to be much more rigorous in what they're saying.
And people talk about us lagging behind Italy and what's happened in Italy. Should we be worried about that?
Italy, the first case happened in early February, and within weeks they had thousands of cases. So there is now a well-described curve. We are on that curve, so without an intervention, we would have been in the same position as Italy.
Finally, Lisa Blackwood wonders whether those who are self-isolating are permitted to take fresh air walks to ensure they retain fitness and, of course, mental health, which is really, really important.
Yes, this is a very important question. We're trying to balance physical health against mental health. So if you isolate, particularly if you're on your own, it's very important, I think, to go outside, enjoy the sunshine, try and avoid lots of other people, and, of course, as soon as you get home, wash your hands.
Bill Keevil, thank you so much for being with us today.